Hello, everyone. Good morning. I'm Chris Krasnowski. I'm the Interim Executive Director at the Wisconsin Institute for Healthy Aging, and I'm glad to welcome you to this learning session today, Innovative Approaches to Falls Prevention in Wisconsin Communities. This session is brought to you by the Falls Free Wisconsin Coalition. We're a statewide falls prevention collaborative made up of local falls and injury prevention coalitions, as well as folks from community-based organizations, health and managed care providers, public safety, and others who are part of a movement to reduce falls in this state. If you're interested in learning more about the coalition or the work of the Wisconsin Institute for Healthy Aging, my organization, I'll be adding my contact information at the end and in the chat later so that you can contact me if you have questions. I'd also like to thank our sponsors for this event today, UW Health, iCare, Humana, and Inclusa. Their support has really made this all possible, both this year and in our webinar series in the past. So it's a real demonstration, I think, of their commitment to falls prevention in Wisconsin. So thank you all so much. You're here today because you know that falls are a growing problem, especially here in Wisconsin, where we have the highest death rate due to falls in the entire country. 1 in 4 older people nationwide have a fall each year. We also know, though, that while falls are a common problem as we get older, they're not a normal part of aging. So as September is Falls Prevention Awareness Month in Wisconsin, we're going to take a look at 3 different community-based strategies for preventing falls with the hope that you find some of these helpful and perhaps replicable in your own area. With that, I'm going to introduce today's speakers. Up first is Mike Stanley, who's Chief of the Oshkosh Fire Department, and he'll fill us in. And if you could all mute your phones, that would be great.
Yeah, no, I appreciate it. Thank you.
Again, quick reminder to please mute. Thanks. So Mike's going to be talking about their innovative Mugs for Rugs program. Next, we're going to hear from Ashley Hillman with Safe Communities of Dane County. She's going to talk about their Only Leaves Should Fall event. And last but not least, Lieutenant Shauna Wallish with the Green Bay Metro Fire Department is going to discuss the Brown County Falls Prevention Partnership, including their .form referral program. We'll hear from all 3 speakers and then open it up to questions, but feel free to add questions to the chat as we can address those at the end. And then with that, I'm going to turn it over to Mike Stanley.
Thanks, Chris. Good morning, everyone. Certainly very honored and humbled to be here with you this morning, and appreciative of all the work that everybody's doing around fall prevention. That we'll talk about why it's so significant here in Oshkosh, but I know we're all sharing some of the same concerns. So if you have questions, like I said, I'll be available at the end, or I'll give you my contact information. Sorry, the host muted us all.
I'm trying to find the phone I need to mute. But keep going, Mike, and I'll try to find
no worries. So Chris asked me to share a little bit, so I've got 340 slides to go through this morning in 20 minutes. It's not quite that bad, but I'll take you through a whirlwind tour. And one of the things that she and I talked about is making sure that we gave you some insights and some actionable items. We've all been to conferences or heard speakers and presentations where they tell you, about what the problem is, but they don't give you any possible solutions. So I want to give you some solutions that we found and explored. Some worked, some didn't, but happy to share that with you. So if we can go to the next slide. That when I got to Oshkosh, I came from Colorado and became the chief of the fire department here. My first logical question is, what do we do here? And just like most fire departments across the U.S. and certainly here in Wisconsin, the bulk of what we do is EMS. Upwards of 75, 80, 90, 95%, as you all probably know, that depending on the agency, EMS is a big part of what you do. But when we drill down a little more into the data and said, what type of EMS do we do? what I found was that we had this incredibly disproportionate number of falls. If you can hit the next slide for me, Chris, please. That, in 2018, when I became the fire chief, we'd run a little over 8,600 calls, and 1,500 of those were for falls. Almost 18%, 17.3%, as you see there. I said, man, that is a lot of falls. That is way too much. And started looking deeper into that of why are people falling down. I said, I'm new to Oshkosh, new to Wisconsin. Is the gravity higher here than in other places? Is it that people are getting drunk and falling down? They're having a heart attack or a stroke and going into cardiac arrest and falling. Why are they falling down? Start digging into that data a little more. Next slide. So one of the first things we did was, we found those 1,500 calls were creating an incredible strain on our resources. And as we looked into what they were, the majority of them were just a straight lift assist, where they really didn't have any medical concerns, that they didn't need further assessment. And, by and large, they did not need transport, in the high 90s percentiles if we weren't taken to the hospital. So we changed our responses so that we were not over-resourcing, and we were utilizing our ambulances a lot, limited number of ambulances here in the fire department. So we changed that so that the fire companies were going out to pick those people back up that have fallen, that just need that lift assist. So worked with our communications center to change the way that the emergency medical dispatching was worked, so that, through that screening process, they would identify that it was just a no injury, tip up, lift them back up call, that there was not going to need transport. So we implemented that. We changed our resource deployment model, and monitor that. And what we found is that we were very, very accurate in and validated that decision, that still in the high 90th percentile, we don't end up needing an ambulance at that call. So helped us with our resource allocation, but we were still running the calls. We still had that phenomenal amount of calls. And, granted, I always have to manage our resources and how they're deployed, and, do we have enough available units, and, what's the impact of call volume, but, also what's the impact on our community. And I don't need to preach to the choir here, talking about that progression that we all know of. Once somebody starts falling down, what's a likely outcome for them, in a matter of months, is bleak. And so one of the things that we have stressed in our community and in our approach to fall prevention is we want people to be allowed to make choices. I like having choices. Most people like having choices. Once you start falling down and you end up, with a broken hip, and your ability to make your own choices starts to decline. So, we debated over semantics of, are we trying to keep people in their homes, but maybe they're socially isolated? I said, what really I think we can all get behind is we want people to make choices. So next slide, please. So one of the things that we did was spread the message, that, I went and talked to everybody that would listen about falls being a problem, and raise that level of awareness. That when I started showing those staggering numbers, it got a lot of attention. So any civic community group that would have me, I went and talked about falls. Whenever I talked to internally to my own people, or to staff of the city of Oshkosh, I had very consistent messaging. I always talked about the number one threat that we have in our communities is falls. And you see the logo for the Oshkosh Herald. That's a local newspaper. We got them to write a series of articles about falls in the aging community, and potential solutions, and how we can work together and collaborate as a community to address that. So, my first take home message is consistent messaging. You said, anytime if this is going to be a flagship program for you, talk about it every chance you get. And I said, if I could be talking about fire extinguishers, I'd turn it around to talking about fall prevention. So inundation with that consistent message is huge. Next slide. And kind of tongue in cheek, at the time I said, falls are the smallpox of Oshkosh. It's an epidemic. and that was a part of the way I grabbed attention. So, this is the smallpox of our age and of our community that, it's out of control and it's getting worse. The numbers continue to increase. And that was a great tagline and really got a lot of great attention for a while. And then about March of 2020, that really lost its luster, when we had a global pandemic. But so that really put a kibosh on a lot of the things we were working on and lost a lot of momentum when, everybody was confined to their house, and especially our high-risk vulnerable population was the same high-risk vulnerable population for falls. So in these past months and, now getting into years past the peak of COVID, we're going back to that messaging and going back to gathering that momentum again. Next slide, please. So many of you have probably seen the video, it's been used in TED Talks about the lone nut, the guy that gets out there and starts dancing around crazy at a concert, and then he gets the first follower and, somebody else dances with him, and then more come, and then it's a movement. So I was the lone nut, going out, like I said, beating that drum of falls are an issue, falls are an issue, falls are an issue. And then I found my first follower, which you see her picture there, Jennifer Skolaski, excellent community activist here, and does a lot of consulting with nonprofit groups that worked with us, worked with me to get other people on board. So we had different agencies that you see there, like, Rebuilding Together and the ADRC and, all these different groups that worked with us and became a movement to get some grant funding to do some research and do a white paper and find out really what is the crux of the issue. Why are people falling down in Oshkosh? And from that, we developed a great white paper. Happy to share that with anybody that wants it. And like I said, we were ready to roll that out, guns a-blazing, in early to mid-March of 2020. And we all know what happened then and went right to the back burner. So next slide, please. So inside that, we said we're going to do a few pilot programs. This is another take home for you. That to receive the funding from our community foundation, it was a basic needs grant that we said that we need to, they said you need to pilot some programs. So one of the things we did is what we called a Falls app, where we were gathering information. It was an opt-in that, sorry about that, that's opt-in for the person that's fallen down. Our providers would go out, they would say, Mrs. Smith, I see you've fallen down a lot, or, Mr. Jones, could we maybe potentially help connect you with some resources? And we would gather that information. At the time we shared it with the ADRC, and they would do follow-up with them, to say, can we come in, do a home assessment, and potentially match you with resources. We also did a mailer, which was like, a warm introduction of the health department. The county health department would love to come in, do an assessment, potentially help you. And then we would visit a number of patients that had fallen, and we would do a warm handoff with an agency called Rebuilding Together, where they would install grab bars and things like that for fall prevention in the home. That what we found out was that, sometimes the plane crashes when you're piloting something. The Falls app, very successful, and I'll speak to that here in just a little bit of how we've expanded that. Mailer, typically those are low on an unsolicited mailer, but ours was particularly low. We got a 0% return. And even with the warm handoff of going and knocking on the door with somebody from the fire department saying, hey, we were here, you fell, we'd like to install a free grab bar. Not a lot of people took us up on that opportunity. A lot of skepticism still around that. Next slide, please. So when we did that white paper, we did community listening sessions, that we brought in folks that from 3 different levels. In our listening sessions, we talked to the potential client base. We talked to people that were at risk of falling down. We went to the senior center, we went to the library, and had focus groups. Then we talked to the forward-facing providers, whether those are physical therapists, home health care, fire and EMS, the driver from Meals on Wheels. Then the last session, it was not so much a listening session, but more so a culmination of the information we had, and that was decision makers, different decision makers in the community, stakeholder organizations, and said, all right, here's the problem. What can we do to address it? And what can you bring to the table? And really one of the things we found out of that white paper was perception versus reality. When we asked them, what could the city of Oshkosh do to prevent falls? Far and away, their answers were, we're saying, what's causing falls? What can we do better? It was poor maintenance on streets, parking lots, and sidewalks. That's the problem. That's why people are falling down. Well, when we look at our data and you look at the information of where we're responding and why, unless you have a sidewalk or a street connecting your bedroom to your bathroom, that's not where the falls are happening. So we had to do a lot of education on what's the reality of you're falling inside your home. That's, we learned a lot more than we thought. We learned a lot about social isolation and, got a lot of great information. And, really the thing we encountered, which I'm sure everybody on this call is familiar with, there's the fear and disbelief. There's a fear that, hey, we're from the government, we're here to help. You're going to try to take me out of my home. And I disbelieve that this is a free option. So those were the things we had to tackle. Next slide, please. So what we were able to figure out is, we know who falls down. We call her Fiona Fall Down. That she's, based on the statistics, she's 72 years old. She lives in her own private residence in a single family dwelling. She fell in her home, most commonly, as you would expect, in the bedroom and the bathroom. Her complaint was general weakness. She hasn't been drinking. It was a mechanical fall. She tripped and fell. And that really is our target audience. So we said, what can we do to address that? So next slide, please. So we've seen them, the falls continue to increase. And initially we wanted to bring down the number of falls that we were responding to. We said, that's how we'll move the needle. And what we found is, you've seen from 2018 to 2021 that we jumped from 17.3 to 21.4, significant increase. Next slide. These next couple slides just show you, we found out too that we're responding to the same person multiple times. And if you go to the next slide, you can see there's certainly some individuals that are creating a huge impact. So we said, with an aging community and a growing community, is it realistic for us to try to move that needle from this many falls to less? And really, we've seen that's not probably the best metric to use and best target goal. It's, so now our focus is, how do we reduce recidivism? How do we keep from running on that person that's falling more and more often? And then, like I said, again, we all know that progression where, they're going to suffer a traumatic fall that, changes the course of their life. Next slide, please. So just more evidence of, we've got some outliers that are generating lots of calls. So how do we move that needle? So one of the things, next slide, please. One of the things we came up with, that we'll talk about today is the Mugs for Rugs program. And if you can play the video real quick, I'd appreciate it.
Falling is the leading cause of injuries and death among adults 65 and older, and roughly 20% of Oshkosh EMS calls are related to falls. Hi, I'm John Holland from the Oshkosh Fire Department. One of the leading causes of falling incidents in the home is from throw rugs. Now, you can trade that rug for a mug and enjoy a free beverage from a participating location. Bring your throw rug 4 by 6 feet or smaller to one of the following locations to trade it for an insulated mug that will be filled one time for free. Locations include Carmel Crisp Corner, New Moon Cafe, the Oshkosh Senior Center, Laura's Cafe, and both Planet Perk coffee houses. Only one mug per person, and you may turn in as many rugs as you want that are 4 by 6 feet or smaller. It's simple. Make your home safer and enjoy a mug of coffee. Thanks to the Ladies Benevolent Society and 4Imprint for making this program possible.
So we worked with our media center here in Oshkosh to create that PSA. And as John mentioned, that we got some donations from the Ladies Benevolent Society on Aging, and from 4Imprint, did the graphic work that you see there to the left of us. or to the left of the screen, and for the mugs. That so the way I envisioned this, in the analogy I made is this is like a gun exchange program, that you see in other communities, big cities where crime is high. You bring a gun in, we'll give you tickets to a pro sports game or something like that. How can we take rugs off the street? If you reference back to Fiona Fall Down, she's tripping and falling in her home. So what can we do to incentivize that, to take up that rug? So we partnered with, a variety of our local coffee shops, and we purposely went with, small business, because this is on the heels of COVID when everybody was shut down. So how do we incentivize people going back to and helping the small local business owner? One of the things I referenced from that white paper was social isolation. So we wanted to get them back together, especially post-COVID, being active, getting up and moving and talking to each other. So we targeted places that already had groups meeting there. We found out through our listing sessions, we've got a group that's called Romeo that meets for breakfast every so often together, and it's really old men eating out is what the acronym that they came up with, and they say we're the Romeos. So we targeted where we knew they were meeting at. That and we had some foibles along the way with this. That we ended up, we did a blitz campaign. Did it around Fall Prevention Month last year. Put out a lot of media about it. And we took up about 110 rugs in that time period. So what we asked the business owners to do, we provided them with a big barrel that they could put outside. We put this big poster on the front of it. Then we put smaller posters inside their businesses and whatnot. But that way somebody isn't bringing a, flea infested, dirty old rug into their business. That was one of their concerns. I said, no problem. We'll provide the barrel. And they said, what do we have to do with the rugs? I said, throw them in the trash. We don't want to take them back up. Just dump them in the dumpster when you take the trash out. That's fine. We gave them just a tally sheet of, how many rugs have, did you bring in? Because some people might have brought in 2 or 3. Mark those down. How many mugs did you give out? And we'll come by every so often, pick up the sheets and give you more mugs. That's, the initial concept we had was every time you brought that mug in, you would get a free cup of coffee, to encourage them to be out and getting around. There are some health code issues with that about refilling a private mug, so that we got a little pushback from the vendors, the partners about that. So I said, okay, it's just a one-time come in with, you get a mug and a free cup of coffee. And that was still well received by the people taking part in it. And unfortunately, there's always people that will, do dumb things and screw up a good thing. So we had a little frustration from a business or two because people were gaming the system. They'd come in with a rug and, they're 30 instead of 70. Don't argue with them. If they want it that bad, it's not your job, for the person running the coffee counter to screen that person out. We had somebody come in with a rug from the dollar store with a price tag still on it and said, we'd like to have my free cup of coffee, fine. But, far and away, we think it had a great impact. So that was, kind of our first foray into, a campaign media blitz with an incentive to take the rugs up off the street. So happy to share whatever I can on that or some of the other initiatives we're working on, but I don't want to be the first guy that gobbles up everybody else's time. So I'm pretty much at my time limit. So again, I know that was a whirlwind tour. We'll share my contact information. Happy to help however I can, and look forward to hearing about the other exciting programs that everybody else is doing.
Great. Thank you. Thank you so much, Mike. I know there'll be questions for you at the end. So appreciate hearing about that initiative though. And we're going to move forward. Next, we'll hear from Ashley Hillman with Safe Communities. Ashley.
Thanks, Chris, and everyone on the call today. And thank you, Mike. I've been very curious about this Mugs for Rugs program, and what a brilliant idea. And the way you use data to inform, the uniqueness of that program. I love it. I hope we can do something similar here in Dane County. So as Chris said, my name's Ashley Hillman. I'm the Falls Prevention Program Manager at Safe Communities in Dane County. Safe Communities is a nonprofit injury prevention membership coalition, and we build coalitions around the top causes of injury death. Everyone on this call will not be surprised. One of those top causes of injury death in our county is falls among older adults. So that's the piece that I focus on. Next slide, please. So I'm going to talk about an event that Safe Communities has spearheaded with the Dane County Falls Prevention Task Force for well over 15 years. Just an quick outline, we'll talk a little bit about the history of the event, kind of what that event structure looked like pre-COVID, how we adapted the event during COVID, and kind of where that event is going now. COVID's not gone, but moving on to the other side of living with COVID. And then we'll talk also about some lessons learned, because there have been many, many lessons learned over the past several years. So just a little bit of history. First, the Dane County Falls Prevention Task Force is comprised of many representatives in our community from the healthcare systems, the ADRC, EMS, senior centers, home health, older adults themselves, United Way. And this group formed originally to look at how do we reduce the rate of falls in our county at both the systems level and the grassroots level. So that kind of a dual prong approach where we work with kind of higher level systems. Are we referring people to the appropriate programs? Are we providing falls risk assessments? What are we doing in healthcare and with EMS and community-based programs? But also, are the programs that we offer accessible to all older adults in our community? So that's, offering stepping on, Tai Chi, ballroom basics for balance, those types of programs. So through this conversation and the goals that we set as a task force, we thought, well, why not hold an event every month during September, Falls Prevention Month, to really try to reach all areas of the county. So originally this event, when we first started, the goal was to rotate locations. So we might have the event on the west side of the county one year, and the next year we would go to the east side of the county. And we just kind of rotated host sites with the goal of reaching all areas of the county at some point. And some of our host sites included senior centers, faith-based organizations, healthcare settings like the hospital. And then, one year we even had it at the Boys and Girls Club, which I'll talk a little bit more about later. The event started small, that's to be expected, around 30 people. And then in 2019, right before COVID, we had over 100 people participate in the event. It was a huge success. And then of course, COVID derailed everything. And changed our approach moving forward. In this event, we have always partnered with UW-Madison and Madison College, several of their programs. And I'll talk a little bit more about that structure in the next slide. So pre-COVID, the way we've always structured Only Lou Should Fall is by providing lunch free of charge and having a keynote address to start things off. So we'll talk about this in the lessons learned, is finding somebody with name recognition to provide that keynote. So we were fortunate enough to have Dr. Zorba Pastor provide our keynote address, probably starting in 2018. And we were able to do that because one of the members of our planning group, who's also part of the Falls Prevention Task Force, was in residency with Dr. Zorba Pastor, so they're friends. And he just sent him a message and said, hey, we have this event, can you speak? And Zorba said, yes, of course, I'd love to. So that's how we made that connection. And that really was a game changer for us in Dane County, because people know the name Zorba Pastor. And a lot of people signed up for the event because he was the keynote. But then once we got people in the door, then they were able to benefit from all the amazing resources that we offered at the event. So after lunch and keynote, we also offered demonstrations so people could get an idea of what we were offering in Dane County as far as balance enhancing classes. So this included stepping on, Tai Chi, ballroom basics for balance, Chicago step in, all types of programs that people may not be aware that were being offered in their own community. And then after the demonstrations, then participants segued into a bunch of screenings. So every participant received what we called a falls report card. So in our partnership with UW-Madison's pharmacy, nursing, and physical therapy departments, and with Madison College's occupational therapy assistant department, we were fortunate enough and had been fortunate enough to work with a bunch of faculty partners and a lot of students who come to the event, and they offer screenings for individuals, including, as you see, blood pressure, medication management, vision, cognition, home safety, and gait and balance. So the goal with this is that an individual could progress through these series of screenings, and then by the end of the event, they really know what their risk of falling might be and what might be causing them to be at risk of falling. So they could really pinpoint what it was that could be putting them at risk. And then the participant would leave with resources knowing, oh, I didn't even know, this was available. I could get a home safety assessment. There might be funding for home modifications. There's a stepping on class starting, that type of thing. And one of the things that we learned is that the students made a huge difference. We had usually one student would be paired with 2 or 3 participants and stay with them throughout the course of the screenings and serve as their patient advocate. So they would go through the screenings together. And then at the end of the event, that student would do some goal setting with the participant and help them figure out what are their next steps for their falls prevention journey. We also offer door prizes like yak tracks and walking poles, night lights, and these were just local donations. Our members of our planning committee would just ask for donations, and we were pretty successful with that. One of the things I'll mention, Chris and I were talking about, how do you fund this event? And we really went local with this. So one year, actually the year 2019, we applied for a local Walmart grant. So Walmart, the individual stores, they have community funding, and we submitted an application, and it was very easy actually. And we just got a check in the mail. So I don't know if it's always that easy, but it was very easy that year. So it was nice just to get that local support. And then also local county support. Our county at least has a few buckets of funding that fund older adult programs or programming for case management, that type of thing. So we were able to benefit from that local funding as well. And then with every event we've had, we always offer evaluations and we provide follow-up, which has also been successful. So next slide. So this is pre-COVID, and then dun, 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 March 2020 changed everything. So obviously, very obviously, we had to significantly adapt Only Leaves Should Fall. And, I'm sure all of you on this call had the same feeling of urgency, knowing that we still need to meet the need of the older adult population, and yet also be super aware that the coronavirus most affected the population we're trying to reach. And that was a really tough spot to be in, knowing that social isolation, as Mike talked about, was exacerbated even during the pandemic because people were isolated. So we decided to pivot to a live virtual format for our event in September of 2020. We were fortunate enough that Dr. Zorba Pastor provided this, a live keynote address. And our goal in 2020 was just to engage people. We just wanted to engage as many older adults as possible, knowing, that a lot of people were isolated. A lot of people needed this information about falls. So that was our goal. We had a live Q&A, and then we worked this particular year with Madison College's OTA program, and they provided assistance for people before the event. You know, if people needed tech assistance, they would have a call with an individual, help them, you know, get onto Zoom or figure out the technology piece. But then we also offered follow-up assistance for those interested after the event on September 22nd of that year as well. So if people needed more resources or were interested about something very specific, then we offered that follow-up for them. And this was pretty successful. We were pleasantly surprised with how many people we were able to engage virtually, you know, also knowing that Zoom and the virtual way of doing things was still fairly new. We were able to get a pretty good number of people. And again, I think it's because of Dr. Zorba Pastor. So then next slide, in 2021, you know, we were able to, I guess, really think about what we wanted our goal to be. So we thought, great, we reached a lot of people in 2020, but we're not reaching everybody. You know, we knew we were not reaching everybody in our county. So we thought, well, what if we have a panel of individuals, of experts, to try to engage a more diverse audience with this varying perspectives of our panelists. So we had somebody who was in family medicine, somebody who's a physical therapist, somebody who had suffered from a fall and, you know, was able to talk about that impact on her and her life, you know, even years later. And then we also had somebody from the insurance field talk about how falls impact insurance premiums and what that looks like, you know, for the broader population. And this was very successful. We again offered that tech assistance ahead of time as people called to register. If they needed assistance with that, we offered that. We also again offered the follow-up after the event for anyone who wanted additional information. But this was successful because we did reach a more diverse group of participants, and just the varying perspectives was, I think, very valuable, a different approach to the event that you know, we'd had in previous years. So then earlier this year, we thought, okay, so COVID is obviously not gone. It's here to stay, and it still affects this older population that we're working with. So how do we navigate this situation? Because knowing people want to be in person, knowing that social isolation is an issue, you know, we often talk about, let's, you know, take programming to our local communities, but we don't often do that. So we thought, what if we actually did that? You know, recognizing on one hand that COVID-19 is not going away. So we want to be cognizant of that and also respectful of people's comfort level of being in person. But also we kind of thought, why haven't we done this before, where we actually take programming to local communities? So we thought, let's try this out, and we'll have mini events at multiple locations in Dane County. So these events are actually happening next Tuesday. So I'll be able to report back after Tuesday and let you know how it goes. But we thought, okay, let's think of some historically underserved areas of our county that maybe don't have as much access to falls programming. And let's focus on a couple locations. So we are fortunate enough to partner with Triangle Community Ministry and Mount Zion Baptist Church, who has actually partnered with us in the past for programs like Stepping On years and years ago. So this year we're having 2 simultaneous mini events, and we will again be working with our student partners at both Madison College, UW-Madison, and now Edgewood College as well. And those students will be split among the 2 sites. We were able to get lunch sponsorships for both locations, and lunch is always the cost. You know, that's usually what we're trying to figure out. How are we going to pay for this? Because we want the event to be free. So the structure will be just as it has been, where we'll have free lunch, a speaker talk about falls, and then segue into screenings and, you know, help people do some goal setting and figure out what can they do to prevent a fall moving forward. So our goal, you know, I think having a very specific goal each year has helped us to be successful. So our goal is to meet people literally where they are and provide falls prevention opportunities for communities that have, been underserved in our county. So we'll see how that goes, because I think from here, we're going to start offering multiple mini events multiple times a year. Of course, in September, we won't change that, but I think we're probably going to do this in the spring as well. And I think we'll do a better job at actually reaching people in their communities by doing this. So next slide. I know this is very difficult to see, but I thought if Chris is able to share our slides afterwards, I just wanted to throw this out there for anyone who might find it helpful. This is our evaluation that we're using this year, actually, for our event. And the evaluations we really do pay attention to, because it's helped us improve the event over the years, and really taking that participant feedback to heart has helped us improve the event. And it has also allowed us to offer additional follow-up resources for those interested. So we kind of, want to know who is attending, and then how was the event? What was it that was impactful for you? But then also, would you like follow-up? And so the follow-up not only helps us continue to provide resources for participants, but it also helps us kind of gauge, were there behavior changes that transpired from the time the event took place, till 30 days later, like what happened? And it's been really heartwarming, I guess is the word, to see that, yes, in previous years, there have been people who, went to their landlord and said, we need, a railing on this sidewalk on the side of the apartment complex, especially during winter, and have, lobbied and gotten some really amazing changes to their homes to prevent them from falling. So we have seen some really positive behavior changes, and that helps us to just know that, okay, this is impactful. So I just wanted to share that in case anyone wants to, use it or offer suggestions for us as well. Next slide. So I just wanted to talk a little bit about lessons that we have learned. I think the big one is be flexible and adapt as needed. Obviously, again, that's preaching to the choir. Everyone had to adapt in 2020 and to be flexible. But even before COVID, we had this great idea. We thought, let's have the event at a Boys and Girls Club, because wouldn't it be cool to have some intergenerational programming? And that'd be great for the older adults, great for the younger participants or people who might be involved. And while the event was successful, we didn't really meet that goal in particular. So then we, learned from that and thought, okay, well, let's try something different next year. And I think also acknowledging mistakes or maybe things that didn't go quite the way you wanted them to, and learn from those things, so you don't repeat them, and so that you are willing to try something new. And I already talked about the participant feedback, but that has really been key for us. The thing that we hear every single year is that the students make this event. I think that one-on-one interaction with a student who is, helping a participant progress through these screenings, and then really talk with them about what are their goals and how can they help and what resources might they need. I think it makes participants feel very valued. And it's also really amazing experience for the students. So we're really fortunate to have that partnership with our local universities. Free lunch, who doesn't love free lunch and just free stuff? So I think, reducing as many barriers or removing any barriers has really helped us engage more people. So the free lunch is a big one. Not providing any sort of financial charge for any part of the event, and then also providing transportation. So there were a few years, this was pre-COVID, that we worked with the county, and the county was able to provide free transportation for anybody who wanted to participate. That's something we did have to coordinate, months in advance. But then we were able to remove that transportation barrier. And then when we moved to a virtual format, providing technical assistance for, individuals that may not be familiar at all with technology, or maybe just, getting used to how to use Zoom or these virtual platforms. I think that really did help some people engage and participate when they maybe otherwise wouldn't have been able to. And I've mentioned this quite a bit now, but having a well-known individual or well-known name to provide the keynote or some part of your event really does get people in the door. So I was taking the registrations one year, and people would actually call and say, I'm calling, to register for Dr. Zorba Pastor's event. And part of me was like, well, wait a minute, this is, Safe Communities and the Dane County Falls Task Force's event. But okay, whatever, it gets you in the door, but it really does make a difference, because then people came and then they, their eyes were open to, wow, I had no idea that I was at risk of falling. And I have all these resources now that I didn't know about. And Dr. Zorba Pastor has been just amazing to work with. Collaboration and partnership are everything. So leveraging everything you can. So leveraging, partnerships for host sites so that you don't have to pay for space, leveraging partnerships for screenings. The students have been amazing providing these screenings for our participants, and then even seeking local funding. So like I mentioned, we had Walmart one year. We've received county funding for multiple years. And then this year we have sponsorships. So we just have our healthcare partners said, sure, I'll provide lunch for 30 people at this site. And I think, with these mini events, it's not as much of an investment for any one partner. So we have different sponsors for lunch for our 2 different events. So it's not as difficult, I think, for them to make the case that, oh, we need to, supply this funding. And then I think the last thing is just be targeted in your goal setting. What goal really are you trying to reach with this? The one year we thought intergenerational programming would be awesome. We learned from that. And then, through COVID, we learned a lot. And now I think we've, our learning moment and our goal is take programming to individuals. Don't expect them to always come to you. And then this year, we're going to really try that and see what happens if we can really pull from these local communities and make a difference in that way. So these are things that we have learned. After everyone speaks, I would be happy to answer questions and also hear from you all about things that you have learned in your September falls prevention events. But I think that is it for me. Yeah, so Thank you. Thank you for the opportunity.
Thank you, Ashley. And yes, we'll hang on to the questions till the end, but there are a couple. So we'll move forward and talk about the Brown County Falls Prevention Partnership and some of their initiatives. I'll turn this over to Shauna.
Chris, and thank you to Chief Stanley and to Ashley. A lot of really great information. So my name is Shauna. I am the Public Information Officer and the Life Safety Educator for Green Bay Metro Fire Department. Our department covers the city of Green Bay, Village of Alloway, and the Village of Bellevue. So I'm just going to talk a little bit about our partnership here in the county, and then some of the things that have worked really well for us, and then a little bit of lessons learned as well. So we can jump ahead. All right, so what is our partnership? Our partnership consists of local health and community resource agencies working together to build these top three priorities, really bringing awareness to why fall prevention is important and it should be a priority in our community, and letting people know of the resources that are available to those that are available. So this is why these 3 points are kind of why we're coming together. You can go to the next slide. So who is a part of our partnership? You see a lot of different organizations and businesses, but really we wanted to kind of incorporate who is involved with falls in our community. Like, who is this affecting and who can, really help us get this message out. So myself, with the Green Bay Metro Fire Department, I hold the chair position, or the kind of the leader for our group currently. But you can see we have the ADRC that's active, the trauma council, health department. So we're really just grabbing at all these areas that we think, can they help us get the message out? Can they help us get some of these resources out? Because these are all groups that, see falls as a problem, or seeing these affect their members or patients. And we just are all looking kind of for the same thing. We want to be able to help. We can go on to the next slide. So I'm going to talk a little bit about this later, but this is kind of our logo, our latest current version. And you can see all the agencies involved. But I'll talk a little bit about this in lessons learned, but just kind of so you can see who's a part of our group here. And you can obviously see we have the hospital systems, the parish, nurse group. So really great people. And I know some of them are actually on the call here today. So hopefully I'm representing us very well here. Go on to the next slide. So again, I talked about the purpose. We want to reduce the falls. Just with the fire department in our just local area, we were seeing that a lot of our call volume was on falls amongst people 65 and older. For Green Bay Metro Fire Department, we respond to over 16,000 calls a year. And that just includes our fires, car accidents, all that sort of things. And with that 16,000 plus number, over 2,000 of those calls were just falls. Some of those were maybe fallen and just need help getting up, or maybe they had fallen and had been laying on the ground for hours and needed some more treatment at a hospital or a healthcare center. So again, our purpose is just to reduce these falls because our numbers are very high. And go on to the next slide. So what does our group do? So we meet 6 times a year. Currently we're virtual just because it works with our scheduling. As you can imagine, just everybody has tight time constraints, and we want to make good use of people's time. So, and with COVID, virtual was just the way to go. We're hoping to start going back in person because we're bringing on new members from the hospital systems or from different businesses that we're hoping to include with this. So just to have that face-to-face. I started with this group in 2019 in December. So I'm fairly new to this partnership. And unfortunately, I got started right before COVID. So I wasn't able to meet a lot of our members until just last week in person for one of our events, which I'll talk about in a little bit. But currently we have 15 people that attend meetings regular. Sorry, can't talk. Yeah, that's kind of just the basic layout of who's coming and how much we meet a year. The next slide, just the basic layout. What do we talk about? How do we stay organized? So you can kind of see, we do a brief roundtable. We want to see what everybody has going on. Usually September, Fall Prevention Week. We want to know what events are going on. How can we help the ADRC let people know about their events going on, all that sort of great things. Upcoming events we touch on. So we just had some events recently. So usually it's the planning, what do we need done? What needs to be done from a marketing standpoint? Other news, sometimes we have guest speakers that will join us. Last year we had a couple students from the UW Health Care program that were looking at writing a paper on falls prevention and programs that are out there. And they kind of wanted to talk to us about what they've been seeing. So that's kind of, we're very flexible and, but obviously our end goal is to prevent falls. So I think listening to outside agencies and maybe other counties and their coalitions and partnerships has been helpful as well. And then we have our goal area. So every year we review our goals. So we have, I think this last year we added marketing, our job form I'll talk about in a little bit. Education, what do we want going out for education for those people that falls are affecting them. And then supporting the statewide initiatives as well. You can go on to the next slide. So our accomplishments, everybody wants to know what has our group done, or what have we been able to accomplish since coming together. So one of the things, the early things that was set up was emergency room referrals, where a patient would come in, maybe they fell in their home, unfortunately maybe had a fracture, but they'll be discharged. They get referred to the ADRC, maybe towards a stepping on program. Just there are many options that they can offer. But really it's just connecting that patient to those education resources. Church mailings. This was really a great thing because we saw kind of just by demographics in our community, we were seeing a lot of elderly people go to church. So we wanted to grasp those groups of people and how can we get the information to them. And then the last two, I'm going to talk a little bit more. Our JOP form, or otherwise known with our department as our fall referral program, and then Freedom from Falls event too. So we can go on to the next slide. So JOP form, what is it? This referral program is connecting first responders to fall patients. I already talked a little bit about just our data, but in Brown County alone, we see 32 reported falls a day. And that's not including urgent care facilities either. So that's within our emergency rooms and our EMS departments countywide. So that's crazy high. And what we were seeing too is we were maybe going to someone's house, not once, not twice, maybe 3, 4, even 5 times because they had fallen. And when we looked at this, we wanted to know, how can we stop from, one, we love seeing people, but we hate seeing them hurt or seeing them when they fall. How can we stop this process, or maybe get them into a program where they can be more confident in their home and live independent for longer? So kind of to break down the program, you can go into the next slide. So this is what the referral process looks like. So 911 call, somebody falls. When we get there, we do our patient assessment as we would for any call, because sometimes we get a call for a fall and maybe it's not our typical lost balance, dizziness, maybe it happened because of a stroke. So, we kind of do our little investigation health assessment. Then we go on to address the need. Do they need to go to an ER for further treatment, or do they not want to go to the hospital, or does a family member want to take them? So that's kind of just the map of, how the call goes from the start to the end. And you can see, if they go to the ER, the emergency rooms have the capability to forwarding them to the ADRC for further resources, but we have a lot of patients that we see that don't require hospital transport or ambulance transport. So we give them a flyer on scene, and I'll talk about that. I think that's coming up here, but kind of to explain, would you like more information on fall prevention? When's the last time you've been to your doctor? Kind of start asking a lot of these questions because maybe they have fallen a couple of times, but this is the first time they needed EMS or a fire truck to come out and help them. So from there, after we talk to them about having those further resources, we go down to consent. We cannot force somebody to take the information if they don't want it. We try to explain, it's a free service provided, but some people just aren't interested, unfortunately. And then you'll see the referral to the other side, and that is for adult protective services and the building inspector, which is specialized just to our community. And I'll talk a little bit about that in the next slide. So the resources here at the ADRC, this is where if we address somebody that has fallen, would you like more education, or would you like to get involved in a program to help you or prevent you from having another fall in your home? So they have to say yes in order for us to give them that information. Sometimes we find that falls are not due to people not being able to take care of themselves. So unfortunately, that would go past the ADRC. So a lot of times, unfortunately, we have to get adult protective services. Are they a risk to themselves? A prime example of this would be a hoarding situation, which is also where building inspection comes in for our agency. Some of the communities are surrounding us, Ashwaubenon, De Pere Fire Department. They have different resources that they like to use, but this is what we have here in Green Bay because we have a strong working relationship with our building inspection group and the adult protective services. So those last two I talked about, there's no consent needed. If we think that they're going to be a risk to themselves or somebody else, that's when we get those groups involved, which we really hope not to. Our end goal is to get them towards the ADRC and get them into some of these programs. Go on to the next slide. So this is the flyer because when we released this program, we found out that we weren't getting the numbers. We weren't getting a ton of referrals. So we wanted easy talking points for our paramedics because they're going call after call after call. And whether somebody has been on the job for 6 months or maybe 30 years, it can be easy to forget, like what are the prime talking points I want to get across to somebody. So this is something that they can read off of on the call, and then they actually leave a physical copy with the person if they would like to get more resources or education. From there, what happens is we fill out a form. So we'll go on to the next slide. So this is done with the paramedics that are on the call. They can do this while at somebody's house, or they can do this back at the station or while they're on the road. So they fill out this form and you can see the contact options. So if it was somebody that maybe fell second time, they're like, I think it's time for me to maybe get involved and get some help, we would click on the ADRC. The agency ID number is just for our purpose to know what rig put this referral in. Was it an ambulance? Was it a ladder truck? Just because we like to see the numbers of who's doing more referrals and who's maybe not doing as many. And then we put down kind of the information needed for the referral that the ADRC would need. And this is all protected information. So our crews fill this out and then they press send, and then this goes over to the ADRC. And then the same thing would happen as well as if somebody were to click adult protective services, that would happen too. Paramedics do have the option to click more than one if they think that, okay, maybe somebody needs a home health nurse because they're not able to take their medications appropriately, as an example. Or maybe they need just a little bit further assistance, maybe from adult protective services. So they can click both ADRC and adult protective services if needed, just to get help from kind of both avenues, just from some of the cases we've seen in the past. But this is just kind of the general form. Again, other departments use a little bit different. It's what works best for your agency. We can go next. So a little bit cost is always a big thing. How much did it cost? So there's different programs out there. This program was set in place before I got involved with the partnership, but there are different cost plans. Just with anything, like if you go to buy like a Zoom program, you have the gold option, the silver option. So if you go on their site, this was just a platform that worked best for what we were trying to accomplish. There are other platforms that do similar things that have HIPAA compliant platforms. So again, this is just kind of the basic of how that went down. We have the Fall Prevention Alliance, which is a nonprofit that help pay for this. They also help pay for other EMS agencies like De Pere, Ashwaubenon that use this as well. But this is, again, one of kind of the things with our partnership group that we talk about is, we're trying to grow, trying to expand. And this is one of the items that has costed physical money to do. But as we get bigger, we're going to probably see more cost arise. And this is probably going to be one of our things is how do we want to fund programs and events coming up? And then on to the next slide. So I believe the next one is our Freedom from Falls in Brown County, which happened last week, Thursday. This was our very first event that we put out. It was a 3-hour event. We started off at 9 o'clock with balance screenings provided by a physical therapist. So people that were interested in that had to register ahead of time to get those time slots. But overall, the event went great. It went smooth. I was able to look at some of our feedback from some of the people that attended, which our attendance was, we were almost at full. Reason why we were totally at full is we had some last minute cancellations, but for a first time event, we'll take it. But for this event, the biggest issue, because we did require masks for this, some of our speakers wore masks when they were talking up front, and just the hearing, the audio was certain things was hard to hear. That was our biggest complaint for this. But overall, we had really great feedback. You can see the different speakers that we had. Some of the speakers that are pictured are part of our partnership. Some of them aren't, but because of their health organization is involved, they were able to reach out and to grab some of the doctors and pharmacists that were a part of this. And then you can go on to the next. So lessons learned just from our group as a whole. I talked about our logo a little bit. So get marketing professionals or somebody that specializes in marketing involved right away. Getting kind of marketing for our Freedom from Falls event when we first started in 2021 became a little bit of a challenge because the hospital systems and the health departments and just every single organization has a protocol that they go by, and not everyone could share the flyers because it didn't match their mission statements, or maybe it didn't match their protocols, whatever be the reason. So this last year, we finally got somebody that specializes in marketing to try and help us create a message that is okay with all of our groups that work so hard to get all this information out. And then within this last year as well, we added, this is towards our JET form, our referral program, is feedback. I started noticing that some of our paramedics were asking about, hey, we had somebody that, we have seen them multiple times and we stopped seeing them. Did this person end up getting help? Or, what do our numbers look like at the end of the year? How many people are actually taking the time and maybe are getting these resources, or how many people didn't maybe follow through? So we do it on an every 6-month basis. The ADRC kind of takes what they receive and breaks it down and sends it back to us and the other fire department EMS groups in our area. So that way we can relay it back when we do our yearly training for our program to show, yes, this program, you really are helping somebody when you take just 5 minutes to talk them through about, falls and what they can do to prevent. So I believe on the last slide here, everything that I talked about is on this website here, just about our partnership. So you can see events that are coming up, a little bit about some of the groups that are in our partnership. We have videos where people can watch with some of our local ER doctors. Just some really great information. So if you see something you like, or maybe you have questions on something, my email is on this website. Otherwise, I believe Chris probably has all my contact information as well. But thank you everyone for listening. Really appreciate you taking the time to come and join us. Thank you.
Thank you so much, Shauna, and Ashley and Mike as well. Great information. And I think, we'll open this up for some questions here, but hoping that this has gotten you all thinking about ways to potentially bring these types of either events or programs, your community, so you can things a little bit differently perhaps than you maybe have been doing in the past or currently. So let's just take a look at the chat for a second. I did see a couple of questions, and I think this first one really pertains to each of you in maybe a little different way. But the question was around marketing, either the program or the event. And I think really, Mike, when we're talking about marketing, we're really thinking about how did you market the mugs for rugs? Did you work through different community organizations? We saw the promo video, which is great. But talk a little bit about that, Mike, how you marketed mugs for rugs.
Yeah, so I'm very fortunate here that we have a great media department within the city. So they were able to put together those video PSAs and announcements, as well as some audio ones. So we've got a cable access television channel. So it went out on that, as well as, we have, I guess, public access radio, we have our own radio station. So they push it out through that, through all of our social media platforms with the fire department and with the city. But some of those partners also share that out in social media. We did a press release and we got quite a bit of media coverage and attention around this. Got it out that way. And then, like I said, we have had a really good partner with a local newspaper that's done a series of articles, and they did a series of follow-up articles as well about falls in the community. So, and then just obviously some word of mouth or, on-site marketing of putting the posters in the storefronts where they could do the mugs for rugs. So it's kind of a combination of all those things.
Yeah, I think the newspaper is how I found out about you. And I had it forwarded to me about 3 times. So it did get some attention. How about you, Ashley? How did you market Only Leaves Should Fall?
Yeah, that is a really great question. We also had the opportunity, and I forgot to mention this, we worked with one of our local access TV, Pittsburgh Public Access TV, and they have filmed the event in previous years, and then they run it, on their local station. But then also when Dr. Zorba Pastor participated, he was a huge help. He promoted through TV, through his column in the Wisconsin State Journal, and on radio. So when those things happened, we started getting a lot of calls. And even when he was not involved, the Wisconsin State Journal would sometimes run an article about the event. And a lot of people, read the newspaper. So I think local newspapers has been a really great way to get the word out. And then through healthcare, we have a lot of healthcare partners on our task force. So, they post information about the event in clinics and that type of thing. But I think the newspaper was big, and also the local news stations was also a big hit.
Right. And you had people register in advance. Yes, Ashley?
We did. We only had 1 year where we didn't, and we wish we had people register, because it was a way for us to gather some information ahead of time. And then we had people register in 2019, and then we had all of the evaluation information. So when COVID hit, and I didn't talk about this, we actually reached back out to every participant from our 2019 event, around 100 people. And we also did a mailing. We sent them CDC information about falls. And that's when we asked them if they needed help to get online to be able to view the September event for 2020. So I think registering has it's a lot of extra work, but there's a lot of value to it.
Mm-hmm. And certainly for follow-up, exactly. You can check back in with people. Shauna, how about your event? And you mentioned the marketing, department folks who were really helpful. Was it, a coalition effort to do the marketing? Did individual groups do marketing? Tell us how that went.
Yeah, so we really use the marketing person through the ADRC to help us with this last event. When we tried to kick it off for 2021, unfortunately, we were unable to have the event due to COVID. We had a bunch of cases and some speakers had to back out. So really, when we tried to get that event initially kicked off, with me, I'm the media outreach person for our department. So I have a little bit of a background with putting out press releases and doing that sort of thing. So I was able to kind of do it on behalf of the department, but also include a lot of our partners too with that. But this last year, we had like a media or a marketing listening session. So we brought, some of the marketing people from the hospitals and from the county, and to see, like what works best for them. And so it's kind of an ongoing learning process, which is, we kind of went 5 steps forward, a little bit of a step back just to kind of get us all on the same page. But yeah, it's just, we're trying to figure out, who's the best person to utilize and, not burn somebody out at the same point as well.
Great. Here's another question for probably Mike and Shauna. Does services like Lifeline, decrease calls to EMS, given that the primary contact might be a family member? Excuse me. So yeah, that's the question. Does having a Lifeline device tend to decrease the calls you get for falls?
Go ahead, Shauna, if you want to go first.
Yeah, honestly, the Lifeline doesn't, just from what I see, it doesn't really make a difference, because a lot of Lifeline type programs are set up so it goes through 911 emergency dispatch. There's some certain ones that will have a secondary call that'll go out to maybe an emergency contact or like a family member. But a lot of times the first call goes to that 911, which would be an ambulance showing up or a fire truck showing up. So that really doesn't decrease. The only thing it really decreases is the injury. So somebody that doesn't have a Lifeline, they might be laying there for more than 30 minutes, maybe even hours. So really it's just getting them the help sooner. It doesn't really decrease the falls that we respond to.
Do you agree with that, Mike?
Yeah, well said, Sean. I would agree.
Great. So maybe let's have each of you give your best piece of advice for getting something started locally, whether that's an event or your coalition, or an initiative like in Mike's case. What's your best piece of advice to someone who may be interested in starting something like this locally, and not sure what to do first? Let me send that to Ashley first. Sorry.
Well, I was gonna kind of defer to Mike, the whole, like, you just go talk to everyone you can about the issue or about the event or about your initiative. I think getting the word out in that way, just the more people hear it, then the more support you'll get for it, the better participation you'll have for it. So I think increasing awareness, whether that's an event or the initiative, in any way you can, would be a way to start. And then also having a core group of people to help with that. There's no way I could run this event on my own. There's an amazing planning group as part of our task force, and everyone has a role to play. So, getting support from anyone else who's interested in falls, and in our case, it really helps just carry the burden, not the burden, but the load of making something like this happen.
Yeah, Mike, what do you think?
I think everybody's going to probably say the same thing, and right on the money with the last comments that you made, Ashley. That's the big thing is consistent messaging. Build that platform. Bring everybody's attention to it, and then finding your tribe. That's you were spot on when you said that about it takes a lot of people to make this happen, and we found lots of people were supportive. When you say we need to stop old people from falling down. Oh yeah, who doesn't want to be a part of that? And yep, we're ready to save the day. But as we all know, when you're building coalitions and associations and starting initiatives, it's going to take a tribe of people that are really committed and who really are going to bring something to the table. And that's what we were able to distill down of who's going to be an active partner rather than a partner in name or, at a distance. So
Mhm.
find that core group of true believers and run with them.
Mhm. But Mike, was I think it was a ladies auxiliary group. They started out as funders, so I'm guessing they kind of covered the costs of the mugs and some of that. And does that relationship continue? Does that year after year, are you buying new sets of mugs and sending, starting over with a different color or something like that? How does that work?
We have not had to do that yet. That was a lesson learned. So great segue in question. I was worried about the unknown of, how many people would come, and I didn't want to turn anybody away for a lack of mugs. So we bought a whole big gob of them in anticipation, because I said, boy, that'd be catastrophic to kill the program in the first week because we're out of mugs. So I've got several cases of them yet, so that I bought big, not knowing, so that would be a caution I would give you is, don't buy 1,000 of these things until you see how it goes, which I did not do. We bought a few hundred, but we still have reserves in place.
Great. Yeah, thank you. Shauna, how about you? Best piece of advice for maybe it's similar. It sounds like what Mike and Ashley said, but any nugget there of advice for getting something started locally for folks who don't have, maybe anything going on at this point or want to be able to create a more robust response to falls.
Yeah, a lot of the same information that was already said, but reach out to other groups that have been established. We've had a fair amount just within the last 6 months of other counties that may not have coalitions or partnerships built and are looking to try and get something started. Reach out to what's around you, like look at ideas and, look at your community and see, will this work for us? And, just kind of build, relationships too with other people, because if you have an issue that comes up, maybe another coalition or partnership has already, stumbled upon that and we're able to overcome that, and see how they did that. But yeah, it's just going to be, kind of make the relationships with people for, via community, all the way to the professional level. So, and I did see there was one question that popped up too, about falls with, have any of these falls been attributed by dehydration, low blood sugar, not eating recently, or poor diet? We definitely see calls that where somebody had fallen due to something like this. Dehydration is kind of one of those where you might see a rise, per the season, summertime, if we have somebody that is elderly, that is totally independent, maybe does all their lawn care on their own or mows their lawn, maybe they just were out working and they got dehydrated. We see a lot of stuff like that. But, we also see too, the failure to thrive end, which is where for our piece, we get that adult protective services in because they can't necessarily maybe take care of themselves and they need further help. But hopefully I answered that question as well.
Yeah, thank you. Okay, I think that's, just double check, but I think that takes care of our questions. You'll be happy to know, based on the good advice of our speakers today, we do intend to have another in this webinar series devoted to coalition development, local falls and injury prevention coalition development. The Falls Free Wisconsin Coalition has created a toolkit that will help individuals, organizations, communities who would like to start or revitalize, a local falls prevention group to support that work and help people develop that in local communities or revitalize one that may need a little bit of a bump to get going again. So watch for that. We haven't set the date, but we do intend to have that webinar, and I think that it was a perfect, and I didn't plan it, segue from your best advice in terms of getting organized and partnering. And with that, I'll say again, thanks so much to our speakers today. Great things happening around the state, and we so appreciate you sharing those with us. It's also again to our sponsors, Inclusa, UW Health, iCare, and Humana for their support. I saw a few questions. Will this recording of this session be available? Yes. We will be sharing it on the WEHA site in the Falls Free Wisconsin Coalition section in a day or so. So watch for that. And I'd be happy to send out to the group that's here just a little link to that. So if you're interested in being able to access it, we can provide that for you. So thanks everyone for joining us. Have a great rest of your day.